Good morning, good evening, good afternoon, wherever you are in the world. Thank you for joining the Chicago Council on Global Affairs for this discussion today. I'm Catherine Bertini. I'm a Distinguished Fellow at the Chicago Council on Global Affairs, and I'm delighted to be joined by Dr. Gro Harlem Brundtland, whom I'll introduce in a moment. Thank you for joining us, all of you, especially our members, and additionally, all those people who have joined to have this discussion today and listen to the discussion today. As you know, the Council is nonprofit and independent, and we are delighted to have our speakers come and express their own views at Council events. Today, we're combining the discussion of leadership and the discussion of the challenge of a global pandemic. And there's no better person to invite to have this discussion based on her work as a health leader than Dr. Brundtland, because she was the head of the World Health Organization and also preceded that by serving as Prime Minister of Norway. People who have been in the development business for a long time might also remember what's known as the Brundtland Commission, but the role that she served as chair of the World Commission on Environment and Development, Our Common Future. She also was one of the founders of the Elders, group of statespeople who go around the world and help to try to resolve conflict and help countries to be able to build out of conflict and work on other good governance measures. She co-chairs now the Global Preparedness Monitoring Board, which was created by the World Health Organization and the World Bank, and we'll be anxious to learn more about that. And she is a board member of the UN Foundation based here in the United States. So Gro has had a lot of relevant experience and also formed a lot of the actions that may be taken by WHO during her time as the director. So we'll look forward to discussing that too. So first, thank you very much, Dr. Brundtland, for joining us today.
Nice to be here. Good to see you, Catherine.
Great to see you, Gro, too. And the audience should know that our terms overlapped. So we worked together on many important projects when she was at WHO and I was at the World Food Program. So thank you, Gro. Thanks for joining us. So we have to start with the pandemics and, in fact, with leadership necessary in pandemics, especially global leadership. We'll get to national leadership a little bit later. What I think many people are concerned about is that there is a deficit in global leadership. And I think there's expectations about what WHO can do or should do or isn't doing. So we'd like to talk a little bit about that. But WHO's role as an agency is one that people don't quite understand. But also the Director General's role, I think, as the leader of the agency is utilized by different people in different ways. So I guess I'm saying several different things here, but I want to get to how you handled the outbreak of SARS when you were at WHO and what you did in order to say, stop this disease, we can stop it. Can you talk a little bit about that?
Yes. The first rumors that came to some of our infectious disease specialists in WHO that something strange was going on in southern China came early January of 2003. And it was clearly something strange going on with a very deadly respiratory infection spreading. We were alarmed about this, and we tried to get contact with China to get more information about it. And as weeks passed, it was really as it was confirmed that something was going on, China kind of stayed silent. My people couldn't get hold of the experts in China. And in the end, I was trying to get hold of the Minister of Health of China. And the answers we got was, no, he is occupied at the People's Congress. So he couldn't take any time off to speak with me. So, then I had to decide we need to be able to have contact with China. This is spreading out of China now. And so I had to speak out. I had to, make public statements telling people that the Chinese were not responding. And then, I mean, gradually they did respond, but it took weeks. It was really a very bad start. Now, when we then got more information from different sources about a new virus, the WHO coordinates research and work across countries. That is a traditional role for WHO. To create cooperation globally on international issues of concern to global health. So clearly, we were assembling expert groups and delving into the issues. And it was clear that this was a new virus. Nobody had seen it before. It took only 4 weeks until it was identified in a collaboration between different experts across the world. And that is important because then you can start making tests. Now, this whole long, process of weeks took much too long. And however, we followed the spread. We saw it spreading to Vietnam, to Indonesia, across into Europe, into Canada, the US, but we were giving travel recommendations. So as the source was in China and then Vietnam and Hong Kong, by the way, then we started giving travel recommendations from WHO, which we hadn't been doing before. And I remember that my expert said, can we do that? There's going to be really a lot of criticism because the airline industry is very much against this kind of action because it has happened before that countries have given, travel recommendations or travel restrictions. And of course, it limits economic situations, it limits trade, it limits people traveling, etc. But because this virus had a 20% mortality in the first weeks and months, I said, we cannot sit here and watch the spread of this deadly virus without giving any recommendation to people where it has spread. So in a way, when there were outbreaks in different parts of the world, we gave recommendations. Don't travel there at the moment. But that had not been done, and I felt very strongly it had to be done, and there is no other international institution that could do it, that has the confidence of countries, scientifically and with regard to health. There is no alternative to WHO doing such a thing. So when people were warning me, you are going to be criticized, I said, look, this is our responsibility. There is no alternative in the world to the WHO doing it. No one else can do it. So we have to do it. Okay, I'll stop there now. Yeah.
Well, I remember when you did that, when the strong recommendation came not to fly in and out of Beijing or Toronto, for instance, that a lot of people were up in arms. But you were strong and you kept that position for some time. I assume until you thought it was safer.
Yes.
But
yeah. Okay. No, the interesting thing is, what many people noticed was that when we had travel recommendation not to travel to Toronto, then the mayor of Toronto was very upset. How can an institution in Geneva tell us in this, part of Canada that you cannot travel here? So he came to Geneva to speak to me. But I didn't take away the travel recommendation. You know what happened? because they were not doing a good job in Toronto, the outbreak spread. They had people with the disease sitting on the in the underground trains and spreading the infection. So the thing I had to tell him is, if you do your job, that outbreak can be brought down to zero. If you trace the contacts of each newly infected person, you have in a public health effort, you can bring down the outbreak, which is what happened. But they had much too many cases in Toronto. So he was not the one who should have complained. He didn't do his job, or they didn't.
Well, you said in a Guardian interview recently, which, by the way, we put out I should tell the listeners as one of the pre-reads for this session, but you said that we are working for humanity. And when asked why you were doing this, and there was a suggestion that you were prepared to lead not based by what the government says, but based by your commitment to help others. So
yeah. You know, I mean, the thing is, countries have been wise enough after the Second World War to create a number of multilateral institutions, including the WHO 1948. Under the impression of everything that had happened until the First and then the Second World War, people were ready to start cooperating in a new way and to create the United Nations, the World Bank, the IMF, and the World Health Organization, and of course, in Rome, FAO, the Food and Agricultural,
organization, yeah.
Organization. So those were some of the first that were created. And it was clearly a situation that it was on behalf of humanity, of the whole of people across the world, that government were called together to try to protect all the critical security issues, economic issues, health issues that apply to all of us. So it's not a question of governments alone, it's the people. We, the people, is in the Charter of the United Nations. And I knew that, of course.
Yes, of course. Yes, of course you did. Well, has something changed? I mean, the charter hasn't changed, but we don't have this kind of leadership right now. We have a very hardworking WHO, no question about that. And we have a smart medical doctor who's the head of WHO, but we don't feel the leadership globally there or from New York. So, I mean, where do we get it from now?
Well, I think for several decades, we had a growing awareness, and I think, of globalization, of the need to work together, of multilateralism as something that a majority of countries and most people signed up to. Only really in the last 4 years have we seen an active effort to undermine, to bring back, and to kind of, instead of having our multilateral system, saying that each nation should care for itself, and that this kind of thinking we haven't really had a lot of until these last 4 years. So it has been difficult for many of our international institutions, including WHO as well. And they are now under attack. Although we are completely dependent on the communicative links, the scientific level of knowledge, everything that brings all countries' science and evidence together so the whole world can have the benefit from it. This is the role of the World Health Organization. And to undermine it criticize it and taking away funding in the middle of a global pandemic is really strange. It is really counter to every, thinking around what we now need to do to overcome this together. Because what the situation is that until the virus has been controlled across the world, every country is at risk. Until the last person in the last country is no longer affected by it, it can continue spreading, continue damaging economies, social systems, undermining human rights, all of what we now see, until we together have been able to control it.
Right. As you did with SARS, because we didn't really finish the SARS conversation.
Right.
Tough action against countries ultimately really helped give them the backbone, I guess, to be able to fight it within their country, and therefore the spread was never as bad as it could have been. Is that a fair statement?
And so I think it was about 20 countries that time that were affected by it. And in a way, the public health efforts that was given advice about from WHO, contact tracing, identifying the virus, and then isolating people or having them into quarantine to avoid them spreading the infection to others, is what brought the different outbreaks in each country down to zero. And when the last patient is recovered or has died from it, and the virus has no one to infect, the virus dies. So in a way, the outbreak in each of the 20 or 25 countries was brought to a standstill, and so SARS disappeared in 4 months. But now, why have we not been able to stop this one?
Right.
Yeah, so because there are some differences. The SARS was more deadly, had higher mortality than the COVID-19 that we are now struggling with. That made, of course, everyone much more afraid of the spread. But the other thing is also the COVID-19 is even more infectious, more highly infectious. So to avoid, to get control over each contact from every infected person is more difficult when the spread goes even more quickly than with SARS. So you have a virus now that some people were, kind of talking away to say, well, it's another flu. No, it's more deadly than the flu, first of all. And it has more complications, higher mortality. So it is necessary not to look up on it as something that the flu, we have kind of, in a way, seen it as part of what we have to suffer. However, we have a vaccine. It's not totally effective, but I have been vaccinating myself for the flu every fall for the last 10 years or so. So people should do that. But, to kind of make it, in Europe, bagatelle, to try to kind of make it a minor issue is what several leaders did in the first weeks and months of the corona crisis. It's not true, because it is overwhelming the health system of every country where it hits, which we could see. So many got sick, so many needed respiratory, what you call it, respirator is in my language, but yes, now what they call it?
Yes.
No, ventilator.
Oh.
Then, so many get critically ill and need advanced ventilator systems,
mm-hmm.
and really trained personnel. It cannot be dealt with like the regular flu. So many get really bad respiratory symptoms, and of course the mortality it's not clear exactly the percentage, but it certainly is more deadly than the flu.
Now, we understand that. Many people understand that, but you're right. Many people still do not understand that. Since you've talked about national leaders, let's shift to their responsibility for a moment, too. We've seen a lot of different models of leadership from around the world, from people who've taken this very seriously from the moment they knew to people who ignored it. to people who are flaunting the problem now, and then some who have taken the position that, well, okay, we're going to be careful about it, but we're going to let people go on their own way. Is there any one model that works, or is there any? Are there any specific leadership styles that you think people need to be using to be most effective as national leaders?
Well, it certainly has been necessary to do social distancing very seriously. It has been necessary to establish and produce the equipment that health personnel need to protect themselves, to be able to help the sick. And of course, the testing, to make tests available is a major undertaking. And if it's not taken seriously and not sufficient testing is produced, then you really lose control over the virus. You don't know how many are infected, and it's very hard to deal with, which has been part of the discussion I have seen over weeks and months now in the US, where, sadly, the CDC stumbled in the beginning because it created a test that was not workable. So that was just bad luck, probably. However, it really took away several weeks. And, in a spread like with this very infectious disease, one day creates thousands of new cases. So it's not as if a 1 week sounds very short, but it can be a dramatic difference from one day to the next day, and certainly in a week. So, and it is not only the US, several countries were slow to get testing available. Other countries, like South Korea, did a great job in getting testing available, and they made these drive-in systems where people could come in their car, drive through, and be tested, and they result available in a day or two. So there is a big difference between countries. South Korea did a good job, although they were unlucky in the beginning because of some big religious gatherings that spread to thousands and thousands of cases. And these people moved to different parts of South Korea. So they had to do a large contact tracking system, but they had the tests quickly, and they brought it down to nearly zero within 6 weeks or so. In Europe, there have been different experiences. And even in the Scandinavian countries, countries that are so equal in many ways, and so much, common history, and we have a health system that is available to all, and so on. Even there is a big difference between what happened in Iceland, Denmark, Norway, and Finland compared to Sweden. And they have used different kind of processes. Sweden took less serious lockdown procedures in their advice to the country and their regulations. I think, and they say, believing that if you could develop immunity in the population gradually, then that, because we can't get a vaccine until a year or 1.5 years. And meanwhile, they thought they could develop immunity in the population. Now, after 3 months, there is only, even in Stockholm, maybe between 5 and 7% that have had the disease. So you certainly you need to have 60, 70, 80% immunity in order to bring down a crisis like this. So it is now, therefore, there are so many more people who have died in Sweden than in Norway and Denmark. It's a strange situation. And so they have more than 4,000 dead in Sweden. In Norway, 230. So, it's a dramatic difference. And, as we now go through all of this experience, we as a humanity and as all our 195 nations, there will be scrutiny, there will be investigations going on about, and reporting learning experiences from every country, and of course of WHO and other international institutions. And we will learn from that what has worked and how and why. Because every new kind of disease like this has new characteristics, and you need to be, first of all, prepared for any such thing, but you also need to learn as we get more and more knowledge of the disease pattern, of the spread pattern, of the virus load does it matter whether you have a big virus load when you are infected? And I think it does. Many things we have learned on the way in these 3 months.
Yes, and interestingly, you answered one of the questions we were going to get to about the difference between the way Norway and Sweden handled the issue. Yeah. So thank you for that. The Global Preparedness Monitoring Board that you co-chair, I think, has some advice about dealing with some of these infectious diseases. And do you have any thoughts to share with us about advice from the board that we should all be paying attention to internationally?
When the world had gone through SARS, MERS, H1N1, swine influenza, and Ebola, in all of these these tragedies that happened, there were, of course, follow-up and learning experience across the world. And under US and UN leadership, a lot of effort was made to increase global preparedness based on all of these quiet, dramatic experiences that the world had gone through until 2014, when the Ebola crisis really was at a stop. So a lot of things were decided during those follow-up exercises. One of them was to get an agreement about having a board to watch and to really analyze and recommend about the global preparedness in totality. So that board that I co-chair was established 2018 after a process of improvements in many areas, but saying we need a monitoring board. So the World Bank and the WHO together created the board. We gave our first report in September last year. And we saw that the preparedness in many countries were really lacking. There were big gaps in what had been agreed in the World Health Assembly, what the countries had signed up to in the global agreement that's called the International Health Regulations. That's a convention that is legally binding. But when you look at what has happened, relatively few countries have really followed up to the extent that was intended and that they committed to do. So in that report, we gave all of that data. But we also warned that the risk, and this was to underline the importance of improving this preparedness, which was so much lacking. We are going to see a respiratory illness with highly infectious virus, and it can come anytime soon. We don't know when, but it will come. And so what happened from November on in Wuhan, China, we warned about 2 months before. And sadly, it took only 2 months after that warning before it was all over us, a new pandemic, in many ways like the influenza pandemic, around the end of the First World War, 100 years ago, more than 100 years ago.
Well, first of all, you were prescient, the board, but second of all, that also highlights what you said before about whether or not the international community is ready for global interaction and global work together. Do you think that after the pandemic is over, there will be a renewed commitment to working together?
I do believe, and maybe I'm hopeful, But usually in my life, I have come to the conclusion that unless you are optimistic and believe that things can improve and be done, you don't have the sufficient energy and to move and to try to make a difference. I do think and hope that the world will have learned something from this, because look what enormous consequences. I mean, the economic consequences are now obviously as large and maybe will be even larger than the financial crisis of 2008 and 9. It has hit countries across the world, and we are not at the end of that story. It's going to take years to build up again the world economy and the different countries' economic situation. And
Right.
so if you are a leader, not a health minister, but a leader of the country, worried like the finance minister about your economy, which most leaders would be, then this crisis really has a lesson to give. You cannot disregard these kinds of health risks, because they do have direct and enormous economic and social consequences. And I had a number here that I thought I would share with you. Now, they have calculated that $375 billion will be saved in the global economy just by having a vaccine available 1 month earlier. Per month, $375 billion is going to be affecting negatively the world economy until we have a vaccine. And maybe we can have a vaccine in 1 year from now. And that is because, and then countries have to, and every research institution that have the capacity have to be cooperating, not only competing to get the best vaccine, but also collaborating in such a way that we can share knowledge early enough so that everyone is really dependent on having as early as possible a vaccine. If you think, it's very important that the vaccine has to be made in the US or made in Germany or made in any other country, if that is the major thought in your head, it can lead to several months of later use of a vaccine that can be globally spread. We need to collaborate as we compete on this, which is happening in different now, with the support of WHO and something called CEPI, which is, by the way, in Norway, which is also comes out of the experience of the Ebola situation, a vaccine collaborating center. And that is, so our GPMB, Global Monitoring Board, came early out in March, warning, or can you say, asking for urgent funding for testing, for diagnostics, for the health personnel, the equipment, and of course to prepare for a vaccine for COVID-19. 8 billion was really necessary. And we took contact with the World Bank and the IMF, and they were responding, but they also told us their system is not set up in such a way that they can easily mobilize, even in an international crisis like this, that kind of funding. They don't have it in their mandate. And so the G20 we took contact with, and also, and from the G20 came a positive resolution, and the EU, under Ursula von der Leyen, she had a pledging conference, and those 8 billion have now been pledged for treatment, for diagnostic, for vaccine development, and also to help the poorer countries have testing equipment available. Because every country is going to go through this because of the strong infectiousness of this COVID-19. Every country across the world is going to be affected at different stages and levels. Yeah.
That's right. Well, and that we have a question about leadership of underdeveloped countries who are in more precarious financial positions. But this certainly, this kind of support will certainly help provide assistance to them. We have multiple people who've asked about WHO warning that came out today of an immediate second peak of coronavirus if countries reopen too quickly. So you would have said earlier that we need to pay attention to social distancing and other measures like that. Is there any other advice that we should be paying attention to as countries do reopen? My friends in Rome are having their hair done, and my friends in Maryland are going to the beach. And so what do we need to pay attention to?
Well, it seems risky what is going on in the US. I have to say that, this whole debate about kind of not taking seriously the advice given by the CDC and by the authorities in public health about what is necessary for each state, in your case, in the US case, to be able to start opening up. Many states have started opening without having filled the criteria that have been made and which are sound criteria. So this is why, you feel there is a big risk that one or more states are going to have real setbacks, new enormous increases in hospitalization and in mortality. So, we are crossing our fingers, everybody, I think, that we are more lucky than we may deserve. But it is now to take the Scandinavian countries that now, Norway, for instance, and Denmark are slowly opening up, but doing it very carefully and looking at the number of tests taken and whether the infection starts spreading again, increasing the number of infected people. So far, it hasn't happened, and the opening up started about 3 weeks ago. So it's the curve has gone down, and it's now flat. So, but it illustrates that it's not continuing to go down. As long as it's flat and under something we call, the recurrence rate, or how many people do you infect each person. This when it all started in Italy, for instance, people were infecting 3 or 4 or 5 more people. When you get that number under 1, that each one infected infects less than 1 or 1, then that means the epidemic is under control and will stop gradually. But when you have them coming up above 1, up to 2 and 3, then you have this kind of curve and many more hospitalized patients. So it is necessary to follow very closely and to be very serious about looking at the different aspects of how to open up and when to stop and to wait. Because we don't have a vaccine. Right. When we have a vaccine, it's a different story.
Right. Well, and of course, this all gets intertwined with, it's like the flu anyway, and all the things you were talking about earlier.
Yes.
Yeah. Well, yes. So we have a big challenge ahead of us. One of the individuals says the biggest challenge is your current successor, Dr. Tedros at WHO. So several people have asked, what's the greatest challenge now facing WHO leadership?
Well, it's difficult when you have major powers like the US and China, in direct conflict over the way to deal with this, over how to analyze what happened, and putting WHO in the middle of the quarrel between the two. It's very hard for an international organization to have member states quarreling about itself. So this is the biggest challenge, and countries need to collaborate to support our multilateral system. We need it.
Okay, I want to shift right before we close. We got about 5 more minutes, and probably the most popular question, Gro, is about you in terms of your leadership as the first woman prime minister of Norway and the youngest person to hold that job. And so the question is about what kind of skills and qualities did you need to employ in order to be a successful leader, especially at a young age?
Well, I think being open, transparent, communicating facts, always building on evidence, which it's my public health training taught me to build on evidence and facts. So I shared with the people, and in a much broader way than in health, what problems society was facing, how we could deal with it, what we needed to do together. And all of that gave many years of reasonable confidence in my party and my own leadership in affecting what people needed and what people thought was right for the country and internationally, because we always had a high international profile, supporting the United Nations, supporting poor countries, high level of development aid, and so on.
Yeah. There's two things one thing you talked about specifically, and another that you demonstrated by your words in this call today. One thing you said was you had to be an optimist in this business, and if not, you didn't have the energy to proceed.
Yeah.
And so I think you must have also been an optimist when you were PM and through your whole career, actually.
That's true.
Yeah. But the other thing, in telling us the story about SARS, that you demonstrated, in my view, is courage. And I never, until I did a paper recently on leading change in the UN systems, I never equated courage with being a head of an agency or necessarily the head of a government. Courage seems more like, the guy or woman that's running around saving people like a superhero. But I learned that superheroes also are heads of government and heads of UN agencies if they, in fact, are courageous. And to me, optimism and courage are two things you've brought with your career and you used in both places.
You're right. So when I said I base myself on facts and evidence and analyzing problems and speaking out about them, this is also sometimes it needs courage to do it, because sometimes the facts are not what people would like to hear. But when you then share those facts and you build a kind of profile, people trust that you are saying what you really believe and think. That is also an important part of leadership. And of course, courage is part of leadership always. Unless you have courage, you're not a leader, in my opinion.
And your opinion counts for a lot because you've accomplished so much. And we are thrilled that you have been able to share this 45 minutes with us, Gro, and that we can learn from your experiences and hopefully model some of your courage and your optimism as we all look to what we can do in our communities in order to help stop the spread of this pandemic and return to a maybe different model, but a new and positive model of life. So thank you so very much.
Thank you, Catherine.
Thank you for your leadership and thank you for your time.
Thank you.